Hi, I'm Hannah Lee, and I did my project over the chemistry of medicine. The chemistry of medicine is a very vast area where there's many different subjects, but I wanted to focus on one, which was brain cancer. On brain cancer, I wanted to see if the medicines that the scientists make, do they really help treat brain cancer? Now, I've done a lot of researching for this, and I've found many clinical trials that are being done to help see if the medicines really do help treat. The medicines that I have found that help treat are called temozolomide, bevacizumab, everolimus, and carmustine. And these medicines are all covalently bonded and all seem to have the same kind of elements. And clinical trials that are being done to check these kind of medicines all seem to be still in order as of right now. Once these are done and they're FDA approved, you can see if the medicines actually work to help treat the brain cancer. If they do, then this will be a breakthrough worldwide for medicines in general, because there really is no cure to cancer as of found yet, and if these help treat the cancer, then it might just be one more step that we need to take to find the complete cure. These trials are being done in Jacksonville, Florida, Rochester, Minnesota, and Atlanta, Georgia. Atlanta, Georgia is home to the CDC, so with that being there, you can test older diseases and stuff with the medicines to even see if that might help treat the cancer. Temozolomide is one of the medicines used to treat brain cancer. We're just going to see if it can treat brain cancer. And it's being done, its clinical trials are in Jacksonville, Florida, and Rochester, Minnesota. This is to see, it checks patients with anaplastic glioma, which this will be given to. They found out in the first phase of the trial that the temozolomide does work, and it does stop the cancer cells, but they're seeing if it works best with radiation or not. And it's given through an IV infusion, which is where they put the actual medicine in with the IV fluid and infuse it into your body, or it can also be given by a tablet. Now, bevacizumab is another medicine under clinical trial right now, and it is performed on patients with glioblastoma multiforme, and it's a vaccine therapy. And then everolimus is a tablet that is given to you, and you take that by mouth. And for my project, I decided to make a children's book. The title of my children's book is Medicine Man. Medicine Man by Hannah Lee. Hi, I'm Medicine Man. I teach kids around the world about medicines they take to make them feel less scared. They have nothing to fear when Medicine Man is here. I'm flying across the world today to meet my little friend Johnny. Johnny is terrified after learning from his doctor that he has brain cancer and has to take a lot of scary medicines. Hi, Johnny, I'm Medicine Man, and I'm here to help you, exclaims Medicine Man. Well, Medicine Man, I'm really scared. I have to take some medicines that I can't even say their names, says Johnny. Johnny, I promise you I'll figure out your medicines and tell you all about them so you're not so frightened, said Medicine Man. Promise it's not as scary as it seems, sighs Johnny. Promise, declares Medicine Man. As I am told, Johnny, you will be taking bevacizumab, temozolomide, and everolimus. These medicines sound super scary, but when you know the chemistry of them,
You seem more relieved, exclaims the Medicine Man. What's the chemistry of it mean? Ponders Johnny. The chemistry is the elements that make up the medicine, explains Medicine Man. Wow, that's kind of cool, says Johnny. Temozolomide has a chemical formula of C6H6N6O2, which means it consists of 6 carbon atoms, 6 hydrogen atoms, 6 nitrogen atoms, and 2 oxygen atoms. The weight of all these atoms together is 194.15 grams, which is called the substance's molar mass, explains Medicine Man. That's pretty cool. What will the medicine look like? Wonders Johnny. Well, it's like a light white powder, but it's mixed into your IV fluid over an infusion, says Medicine Man. This sounds a little less scary now that I know more about it. What about my other medicines? Says Johnny. Your other medicines are bezisterim and everolimus. Bezisterim has a chemical formula of C6H638H100160O2108S44 with a molar mass of 149 kD. It is given through an injection. Everolimus has a chemical formula of C53H83NO14 with a molar mass of 958.22 grams. This will be given to you in a tablet and it will be taken by mouth, exclaims Medicine Man. This is a lot less scary now that I know what is in these medicines, Johnny says enthusiastically. There's one more thing that scares me about the medicine, sighs Johnny. What's that? Wondered her Medicine Man. The names of the medicines, they're so long I can't even say their names, cries Johnny. Well, I have a solution to that. Let's call them medicine T, B, and E. That makes them easier to say and they sound less frightening this way, exclaims Medicine Man. They do sound less scary that way, declares Johnny. Thank you for all your help, Medicine Man, exclaims Johnny. Anytime you need me, just remember I'm a call away, explains Medicine Man. Do you really have to go so soon? Sighs Johnny. Yes, I have to go help other kids like you feel better, says Medicine Man. Well, I guess that's okay. Thanks for all your help again, says Johnny. Goodbye, Johnny. Just always remember, there's nothing to fear when Medicine Man is here, exclaims Medicine Man.
What is an element?
An element is a pure substance that can't be broken down by chemical methods into a simpler component. Every element consists of one atom, which is the smallest particle of an element that still has some properties of the element.
What symptoms do brain cancers cause?
Severe headache, unexplained nausea, and vision problems that cause double vision or loss of peripheral vision. Any more questions? You may be wondering on this page of the children's book what this picture is. This would be the chemical structure of temozolomide. The chemical structure shows the different elements in it and how it's laid out. If you pull out a microscope, you'd see an image sorta that looks like this. So that's what this picture is. And in conclusion, my project over the chemistry of medicines and do the medicines really help treat brain cancer? In my opinion, they do. Through the clinical trials and all the medicines that I've researched about, I feel that they will help treat brain cancer and in the end, we will find a cure to brain cancer.